We are starting the first chapter, disease prevention and health promotion. It is chapter 1 from current medical diagnosis and treatment. Now we will discuss about general approach to the patient. Functions of medical interview. So we will discuss about functions of a medical interview. How basically we will interact with patient. First is collect information. History of present illness and diagnosis. Understand patient values and goals, align care with preferences, assess and communicate prognosis, discuss about the prognosis to patient, realistic expectations, establish therapeutic relationship, trust and empathy, shared decision making, increase patient satisfaction and involvement, influence patient behavior, for example, smoking cessation, medication adherence. So we have to influence patient behavior also. For example, we can ask about smoking cessation and adherence to prescribed medications. Patient adherence is basically asking patient to stick to the prescribed medicines. Importance: adherence following prescribed treatment and behavioral changes, crucial for prevention and treatment success. For example, HIV therapy. Adherence directly linked to viral suppression, CD4 counts, and survival. Common problem is that most patients don't fully adhere to the prescribed medicines. So common problems are up to 50% of patients fail full adherence. One third of never take medicines at all. Short-term regimens, better adherence than long-term. So short-term regimens, these are better for adherence than long-term. Complexity, cost, and perception of over medications reduce adherence. So these point: complexity, cost, and perception of over medications, these reduce. Now we will discuss the main reasons for poor adherence. Main reasons for poor adherence are forgetfulness, busy schedule, routine changes, and psychiatric disorders, depression, substance misuse, uncertainty about treatment effectiveness, side effects and regimen complexity, high medication cost and financial burden, lifestyle changes, diet, exercise, alcohol reduction, harder than pill taking. So these are main reasons for poor adherence. Strategies to improve adherence. So we will implement some strategies for improvement of adherence. One is clear instructions, written or oral. Teach back method. Patients repeat instructions to confirm understanding. Simplify regimens. 1 to 2 doses daily. Generic drugs, medication boxes. Reminders. Reminders are also very important for improve adherence, like alarms, text messages, pill organizers. Social support, like family, friends, adherence monitors. So they can also help to improve adherence. Collaborative care, pharmacist, motivational interviewing, trusting clinician patient relationship. It improves honesty and adherence. So these are very important strategies to improve adherence, so patient can stick to using proper medicine. Assessing adherence. Simple question: in the past month, how often did you take your medications as prescribed? Other method: pill counts, refill records, lab monitoring, appointment attendance, treatment response. So these are important for assessing it. Clinical impact. Partial adherence. Sometimes it is beneficial, for example, hypertension and diabetes. Partial adherence is harmful in HIV, tuberculosis. It is risk of resistance. And guiding principles of care. Ethical principles: honesty, beneficence, justice, no harm, avoid conflicts of interest. Partnership with patient, it is very important. Share decision in screening, therapy, and end of life care. empathy to cure sometimes, to relieve often, to comfort always, mindfulness and patient-centered communication. It improves satisfaction for both patients and clinicians. So these are guiding principles of care. Health maintenance and disease prevention. Levels of prevention. There are three levels of prevention. One is primary prevention, second is secondary prevention, and third is tertiary prevention. In primary prevention, remove risk factors like immunization and smoking cessation. Secondary prevention, it is early detection, for example, pap smear screening test. Tertiary prevention, limit impact of disease, for example, surgery plus radiation for cancer. Now we will discuss about the leading causes of death in the US in year 2022. So these are leading causes of death. Heart disease is number one leading cause of death in the United States. Cancer is second leading cause of death. Unintentional injuries or harm, it is third leading cause of death. COVID-19 is at number 4. Stroke is fifth leading cause of death. Chronic respiratory diseases. Chronic respiratory diseases, these are at number 6 leading cause of death. Alzheimer's disease. Alzheimer's disease is at number 7. Diabetes, kidney diseases, liver diseases. These are liver diseases are 10th leading cause of death in the US. Suicide is at 11. Influenza and pneumonia. So influenza and pneumonia, it is 12th leading cause of death in the United States. So these are leading causes of deaths in the US as of 2000. Preventable causes of death. So we will discuss about the preventable causes of death. So these are tobacco use. It is preventable. High blood pressure, it is also preventable. We can control blood pressure. High blood sugar, so it is preventable cause. Poor diet is also preventable cause. We can improve diet to increase health. Obesity, high cholesterol, alcohol use and drug use, and these are preventable causes of death. Prevention of infectious diseases. Decline in infectious diseases due to immunization, sanitation, nutrition, non-pharmacologic interventions, masking and air quality. Immunization, it is the best prevention against infectious diseases. COVID-19 impact. More than 6.9 million deaths globally until 2023. Vaccine preventable diseases. Hepatitis A and B, influenza, pneumococcal infections. CDC recommendation, vaccination for all more than 6 months old. Addressing vaccine hesitancy, it is crucial for public health. Screening for STIs, chlamydia, gonorrhea, syphilis in high risk groups. So these are very important for prevention of infectious disease. Now we will discuss the key medical terms used in our lecture. Adherence. Adherence is following prescribed treatment and behavioral changes. So we prescribe treatment to patient, and adherence, it meaning is following this prescription and treatment guidelines and following the prescribed behavior. Teach back method. Patient repeats instruction to confirm understanding. Beneficence, acting in the patient's best interest. Beneficence is its meaning is acting in the patient's best interest. So justice, fairness in medical care and resource allocation. Primary prevention, stopping disease before it starts. Secondary prevention, detecting disease early. Tertiary prevention, reducing impact of established disease. So it is in tertiary prevention, disease is established and we reduce its impact. Virological suppression, keeping virus levels undetectable in blood. Motivational interviewing, counseling technique to resolve ambivalence. Health literacy, ability to understand health information. We will discuss summary about this our lecture. The medical interview is central to diagnosis, patient engagement, and behavior changes. Adherence is a major challenge, especially for long term and complex regimens, but can be improved through clear communication, simplified dosing, reminders, social support, and trust. Ethical principles guide care, emphasizing empathy and shared decision making. Preventive medicine operates at three levels: one is primary, other is secondary, and tertiary, and remains underutilized despite its proven benefits. Infectious diseases prevention leaves heavily on Infectious disease prevention relies heavily on immunization and public health measures, with COVID-19 highlighting both the importance of vaccines and inequalities in the healthcare. So we have discussed summary of our chapter.